You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marcagiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. And we are live. It's Dr. J here in the house. Evan, how are we doing today, my man?
I'm doing really good. What's going on in your world?
Hey, not too much, man. All is well. Excited to connect with some patients here today. I know we chatted kind of in the pre-interview that we were going to focus on mast cell and histamine issues. So really excited to dive in on that topic today, man. What do you think?
Yeah, this is getting more common, and I think it's due to more toxicity. I'm actually interviewing a lady named Beth today about mast cell issues, which can happen usually due to some sort of toxin. So it's not that your mast cells, part of your immune system, it's not that just magically starts reacting to everything like foods and fragrances and chemicals. There's usually a trigger. So Lyme is a big trigger. Co-infections like Bartonella are a big trigger. You've got various pesticides and herbicides. Just any toxin can basically damage this, we'll just call it a recognition system that the immune system has. And now you get to a point where your diet becomes an issue. And every time you eat, you feel bad. And, you know, we've had so many clients and patients that begin to get fearful about food. And they're down to 6 or 10 or 12 different foods that they can eat because everything else causes them a worsening of symptoms. So we're going to kind of dive in today about what are the safer, lower histamine things, and what are even some of the foods that may help to reduce the histamines to where you can start to gradually go back to a normal diet, not be so restrictive.
Exactly. Now, we have kind of the pathological form of histamine issues, which is MCAS, mast cell activation syndrome, and that's where you're going to have a lot more severe issues and or sensitivities in regards to histamine. That could be headaches, that could be skin issues like the urticaria, hives, wheals on the skin. It could be brain fog is a big one. Of course, mood and energy issues. So there's a laundry list of different things. Now, the key thing that's going to drive histamine issues is increased inflammation in the body, in particularly the gut. And you mentioned earlier toxins can have a big one. So I know in your situation, mold exposure really increased your level of histamine symptoms. So of course, mold could be a big one. Exogenous mold from water leak in the environment. Also endogenous toxins like lipopolysaccharides or endotoxins from bacterial infections and or parasitic infection biotoxins or fungal mycotoxins from endogenous fungus in the body. That can also be a big one too. So a lot of people get myopically focused on the things you have to do to fix it, what foods to cut out, all of that, which we'll talk about in a minute. But we also have to look deeper within and say, why is this now an issue where in the past it wasn't? What stressors in my stress bucket accumulated over the last bit of time to allow me to get to this point where now I'm so sensitive?
Exactly. And the issue with the nutrition people, and, you know, we talk about nutrition all the time, but the people who brand themselves as just straight nutrition is they'll put people on these restrictive diets and then that's it. And then here you are 6 months to a year later down the road, you haven't added any new foods back in, or if you did, you had reactions. So then your nutritionist advised you to just pull those foods back out. Oh, you can't do butter, pull it back out. Oh, you can't do rice, oh, pull it back out. And then it's like, okay, then what? So then you get stuck. And that's where we are now. We're in that stuck phase. And now let's talk about, okay, what are you doing? What are the Band-Aids to calm the system down from a diet perspective while working on these root causes?
Yeah, and the foods may be an issue longer term, right? There may be an inflammatory component to the food. There may be an allergenic immune component to the food outside of just the histamine content. We don't know, but we kind of have a baseline way of making the food the least amount of making sure the food provides the least amount of inflammation on your body, onto your stress bucket, so to speak, so you can adapt to it. And then also the food's providing you a lot of nutritional density as well, because we need nutrients to run our system, while at the same time we need to decrease the effect of inflammation that food will have. So it's kind of a balancing act, right? And we have to look within, look deeper to make sure the root causes of that inflammation, or to look at kind of our timeline history of how we got to this point, make sure the root cause is fully addressed. So if it's an emotional stress issue that compromised our gut and our immune and our adrenals and our hormones, and then we got exposed to an infection, and then now our digestion stinks, we have to cut all these foods out. Well, we have to make sure that we get that underlying stress handling system back up and running. We have to make sure that we address the infection and the immune response in the gut, and then potentially down the road get some of these foods added back in, doing a elimination reintroduction diet, but making sure we fix all the 6 R's, right? So my 6 R's that everyone hears like a broken record are going to be removing the bad foods. With histamine, that could be histamines, it could be autoimmune, it could be low FODMAPs, it could be how we prepare and cook the foods too. That's going to be dialed in per patient. Second R is going to be replacing enzymes, acids, and or bile salts. Remember, healthy food not digested properly is a stressor on the body. Third R is going to be repairing the gut lining and repairing the hormones so we can deal with inflammation and stress and have a better immune response. Fourth R will be removing the infections, and this is where parasites or H. pylori, or it could be mold in the environment. Like in Evan's situation, mold could be an issue, right? Parasites, fungus, H. pylori, SIBO, SIFO, all those things could be an issue. Number 5 is repopulate, reinoculate good bacteria. And this typically has to happen afterwards. Some people do well adding in probiotics before things. It can help with inflammation or digestion and motility. Some people feel worse, meaning they're probiotic intolerant. The more worse you feel, typically it means the more your gut has lots of bad bacterial issues. And it's like trying to throw a whole bunch of seeds into a garden full of weeds, or it's like throwing a whole bunch of wax on a dirty car. There's an order of operations, and when things are so bad, where the weeds are so bad, you just can't throw seeds in the garden. They're just going to be swallowed up by the weeds. And then the 6 R is retesting to ensure you've knocked out what your main focus was to begin with.
Yep, well said. Let's get into the meats. So this is something interesting. I had heard talks about histamine and leftovers, and I was like, oh, really? Come on, like leftover meat, histamine, is it really a big deal? But I started to notice, especially if I was doing coconut aminos or something else that was fermented or higher in histamine, and I would eat those leftover meats, I would notice some changes in symptoms, whether it was something with like my daughter. She was kind of the canary. Her skin would flare up a little bit. She'd get a rash on her cheeks. So we just stopped doing leftover meats, and now I only cook the meat fresh. And that alone, just ditching leftovers and only cooking meat fresh, has been huge. Now, there's also talk about buying frozen meat versus fresh meat, and that fresh meat that is at a refrigerated temperature is going to build histamine greater than frozen. So I've done this experiment of this is very interesting, taking bacon that's uncured. Cured meats are always a no-no on anybody's histamine issue. They're going to know you got to stay away from cured meat. So we obviously do the uncured bacon. But here's something interesting is we would take the bacon that was in the fridge, leave it in the fridge for a couple of days, and then cook it and eat it. And then my daughter would get a rash, versus if I took the bacon, brought it home, froze it immediately, did a quick thaw on it, just run it under some water, cook it immediately. So frozen to table, basically, there was no rash at all. So I can't say with 100% confidence, but I'm pretty sure that was the secret is, even if you can't buy your bacon frozen, if you buy it refrigerated, you then freeze it. To me, I think that is knocking down some of the histamine content.
Yeah, interesting. And again, people listening to this, if you don't have a histamine issue, it may not be necessary. So don't freak out and go to these extremes. I do think you should try to consume your meat within 3 to 4 days. So I use the Instacart app or the Prime Now app, and I'll go to Whole Foods and I'll have stuff ordered and dropped off twice a week to keep it fresher, So if that's an option for you, utilize it. If not, try not to buy all your meat. If I do a steak, I'm going to buy my steak that day and do it fresh. I just feel like the taste and the flavor is just so much better. And I hate looking at steak that's oxidized, where it loses that heme bright red color and it looks more brownish and dark and pale. I hate that.
Yep.
So I do my steaks fresher. And
I just want to restate your disclaimer, because this is a special conversation. This conversation does not apply to a lot of people. So please don't become even more anal with your diet. This is for people that are struggling and having food reactions.
It's already pretty stressful. So what I tell patients who are, let's say, if you're in this category, you keep doing what you're doing, have a good paleo template or customize it accordingly. Don't worry about it. Take it with a grain of salt. Now, if you're very histamine sensitive, we talk about cooking methods. Well, guess what? A crock pot, the slower cooking is known to accumulate histamine. So you have to be careful with that. So what's the solution there? Well, what I found that tends to be helpful is faster cooked meals accumulate less histamine. So what's a great way to have the crock pot vibe of a soup or a stew and have all that broth is use an Instapot. It cooks it a lot faster. It's a pressure cook. Because the meal's cooked within 30 minutes to an hour, it's going to accumulate less histamine. And it's also going to be broken down very well, so it's going to be easier on your tummy. So what I would tell patients is just go out, get that cut of meat that you're going to have for the day, throw it in the crock pot, put your vegetables or your safe starch in there, add some water, make it a soup or a stew, right? A little more water becomes a soup, a little less becomes a stew. And it's going to be pre-digested, and that's what you eat for the whole day. And then every day you just do a new one. And because crock pots or because Instapots are so easy, which is basically a crock pot hybrid pressure cooker, cooks it fast, you throw all your food in there, you're done for the day. So people complaining about, oh, it takes so long. No, get your protein source, throw it in. If you need some carbs, cut up some carrots or squash or sweet potatoes if you can tolerate it, peel them. Get a couple of vegetables. You can always do some onions or celery or carrots, throw it in there, done. That's it. That's what you have for the day. And then you can rotate your proteins each day. So you can do beef one day, lamb one day, chicken one day, pork one day, and just kind of have a rotation component to at least the meats. That way you have different proteins coming in, so less chance of a food allergen.
Yep. Do you want to go into specific foods now? Like, do you want to talk about, I think it's important to mention some of the fruits. Like, we've got some comparisons of like lower histamine versus higher histamine fruit. So something that I actually reacted to.
Just to kind of highlight one thing, I think it's important to put foods in categories. So when we look at histamines, there are foods that are high in histamines, okay? Then there are foods that stimulate histamine release in the body, where they may not have a lot of histamine in it, but it may stimulate internal release. And then there are foods that block the enzyme to metabolize histamine. And there's kind of an overlap. So the enzyme to metabolize histamine is DAO, diamine oxidase. And so there are some foods that will block that. And then there are also the histamine releasing foods, and then foods that are just naturally high in histamines. And we can go over those three categories. People can wrap their heads around that.
Yep. Citrus was big, and I didn't realize that avocado would be technically in the fruit category. It's always like this debate of fruit, vegetable. Okay, anyway, avocado caused me migraine headaches, and it took me a long time to figure this out, because I would have certain meats, certain veggies, and all of a sudden I would throw a little slice of avocado on there and I'd get a headache. And avocado is one of the highest. In terms of fruits, it is one of the highest histamine. And now I think it contains high histamine. I'm not sure if that's one that it contributes or messes with the enzyme. I don't know what. All I know is that it's a common issue because so many people do avocado now. They throw it in smoothies. They throw it on top of your Chipotle bowls. And so I think avocado is becoming abused in paleo world, which is okay. But for me, it was an issue, and I had to pull it out for about 6 weeks, reintroduced it, and then I was fine. Exactly.
So I'll attach my link that I've made looking at a couple of histamine articles and kind of making a compendium. But you have your foods that are high in histamines, which we already mentioned. Avocados are on that list. So are a lot of your cured and lunch meats. So are a lot of your fermented foods, right? Sour cream, sour milk, buttermilk, sourdough bread, kimchi, sauerkraut, those kind of things, your fermented drinks. So that could be alcohol, champagne, beer, kombucha would be on there too. A lot of your citrus fruits, aged cheese, your nuts would be on there. The big veggies that are going to be on there are going to be avocados, eggplants, spinach, and tomatoes. Smoked fish would be on there, any of your jerkies, foods that are more preserved. So those are going to be your foods that are really high in histamine. And then your histamine releasing foods are going to be alcohol will stimulate histamine release. I mean, if you notice a lot of people that have Asian descent, they tend to get very red or flushed after alcohol, and they take Pepsid AC, which is like an H2 blocker, histamine blocker, to help prevent that. So people with Asian descent tend to have sensitivity with the histamine release from alcohol. Then bananas and chocolate and cow's milk, and then nuts as well, which is remember, there's an overlap. So some of these foods that are high in histamine can also stimulate histamine release. Pineapple, your shellfish, strawberries, tomatoes, wheat germ. And then your enzyme blocking foods, your DAO blocking foods are going to be alcohol, any of your energy drinks, your teas, your mate tea, your black tea, your green tea. So anything that's going to be more stimulating or caffeine-based drink is going to stimulate more of the DAO blocking. So you won't be able to metabolize that histamine in your body as efficiently.
Here's the interesting thing with nuts is depending on, I mean, there's several different lists out there. Some lists are better than others, but one list that I have on nuts, I tested it, and it was said that walnuts, cashews were higher histamine, and then almonds were considered lower histamine. Pecans, pistachios, pumpkin seeds, macadamias, these were all considered lower. So I tested it, and I noticed I was getting a headache if I did too many walnuts. So I do believe that some nuts could be okay. Like if I do almonds or almond butter, I'm fine. I have no issues at all. Whereas walnuts, even though I love them, too many can be an issue. So I don't think all nuts are off the table. I think if we just pay attention to the big ones, like according to this list I'm looking at, walnuts and cashews were the biggest. I've tested those, and I could confirm I did react to those the most. And it's mainly, the problem is, and this is why it's so hard to do a podcast like this, because it's so dependent on the person. The dose that affects me may not affect you, and there may be a person listening where a small dose of like one walnut could be enough to trigger somebody, whereas for you, it may be a cup of walnuts before you have any issue.
Yeah, absolutely. But also, a lot of people may be confusing histamine with just generalized food allergen issues, right? And it may not be necessarily a histamine issue. It could be just a food allergen issue. And so how would you know it's histamine versus food allergy? Well, you're going to see those typical histamine symptoms with like any of the hives, you know it's going to be histamine, right? If you notice like headaches or brain fog right after a meal, that's tough because those symptoms correlate with food allergies in general. How you would know is you just see a correlation with fermented foods, or you see a correlation with citrus foods, or just those higher histamine foods. That'd be how we know. Because coming off the bat, when I'm working with patients, we're cutting out autoimmune foods a lot of times, and maybe lower FODMAP foods, depending on their gut health. And then from there, if we start seeing a correlation with histamine symptoms, especially the ones I mentioned, and or histamine foods, then that's how I'm going to know. But off the bat, like we talked about before, is lectins and irritants in the food could easily be driving histamine, or other types of immune issues that don't involve histamine. So histamine, it's a neurotransmitter actually. It's made from histidine, and it's being produced by the mast cells. And mast cells are basophils. Once they go outside of the blood into your tissues, they become mast cells. And so these immune responses stimulate histamine release. The problem is, because it's an immune cell releasing that, you can still have allergenicity to food. Let's say you have some gluten, right? And you're going to have an immune response that could create other T cell or antibodies, as well as a mast cell release of histamine. So you can have a couple of things happening at the same time, and it's not going to be a linear, oh, this food causes only histamine. You may have an immune response that hits a couple of different cascades: histamine, various antibodies, T cell response, right? So there could be lots of different things happening. So it's really hard to say, oh, this is just histamine, this is just a food allergen. It's really hard. So you need a trained person that's kind of looking at it and trying to use deductive reasoning to figure out what the issue is as well.
Very good point, because that's the hard part is then people try to make this black and white and kind of robotic in the sense that they'll say, oh, we do think this is a histamine reaction, so you can either go to a lower histamine vegetable or fruit, and then you can take some supplemental DAO, but that might not be the answer, you're saying, because it could be a food allergy reaction, and it doesn't matter if you take things to lower or help digest histamine better. The food allergy reaction is still causing the symptom, although the histamine component of that reaction may have been tuned down.
Yes, it's kind of like this too. Like some people have a lot of SIBO, small intestinal bacterial overgrowth, and that causes them to be very probiotic sensitive. So when they have probiotics or even fermented foods, they have a reaction. But now they're like, wait a minute, but probiotics and fermented foods are on that histamine list. So is it a histamine issue or is it a SIBO issue? And it could be both. It could be the SIBO is driving the histamine. So we have to figure out what foods allow you to feel the strongest, right? Like if Superman or Superwoman is weaker when they get exposed to kryptonite, what's your kryptonite when it comes to your food? So that's going to allow us to heal faster if we can find out what our kryptonite is, but we have to be focused on the root cause. Is the root cause histamine or is the root cause SIBO causing a secondary histamine issue? So there's primary and then there's secondary and even tertiary things that we may be addressing. So it's important that something's tertiary, we're not going to treat it the same way as if it's the primary issue. So it's good to line those things up in your head so you can prioritize things accordingly. And a lot of people, they confuse the secondary and tertiary issue as the primary issue. So they get some results because they kind of, a broken clock's right twice a day. So they eventually hit it, but they miss the root issue.
Yeah. How many times do you think that's happening? I mean, make up a percentage. Like how many times do we think people are going down this histamine rabbit hole thinking it's primary, but it's not?
Frequently. So, I mean, if you're like the big foods are going to be like, people feel worse with avocados, right? Well, that's a really good kind of paleo food. All right, that's interesting. Or citrus, fruit, those kind of things. I'm like, all right, or if I'm really having like some tea and I'm really having it. Okay, so kind of like these foods that like the paleo community or the natural health community think like, hey, they should be relatively healthy foods. And you kind of have an issue. That's a good sign there's a histamine overlap. And it's never like we're going down one track, like, oh, we're down the histamine track. We're down the autoimmune track. We're kind of doing a hybrid of different tracks at the same time. And that's hard people to wrap their heads around, and they get very overwhelmed. And when people start heading down a track, they're like, I'm heading down here for life. And it's not like a season for a reason, right? It's kind of like the mindset is this is forever. And it's important to work with someone that can get your mindset right, because that mindset sabotages people. Because forever is a long time, and they're like, I'd rather just be sick, whatever. So you have to have the right mindset when you're going down a path so you understand what that timetable is and what the progression is to open new foods up.
Yeah, for me, I could have thought avocado was the primary bad guy. That was what was causing me the headaches. It almost felt like a migraine. It was just this head pressure. But that was at the same time that I had gut issues. And so I was working on my gut. I was using antifungal, antimicrobial herbs. And by the time I was done with a 6 or 8 week protocol for the gut and I added avocado back in, I was perfectly fine. So you made a great point, which is that if you were able to tolerate these things before, which I was, and then all of a sudden I couldn't, what changed? And I had extra gut symptoms. I had extra skin symptoms, extra mood symptoms. So it was kind of this, I guess, using the histamine template or the lower histamine approach was the Band-Aid, or maybe like the neutral in the gears. It's kind of like, okay, we're not going to be sticking with this diet forever, but let's try to get it into a stable place to where we can work on other things. I peeled back the gut layer, threw the stuff back in, I was fine.
100%. And I tell my patients all the time, you have the right to have more than one issue going on at the same time. So if you think you have a histamine issue, you probably have a bunch of other issues happening at the same time. So just remember that more than one thing happening. It's like, one of those Venn diagrams. It's like a circle, and that other circle overlaps, and there's another circle that overlaps, and then there's the 3 circles in the middle that have an overlapping feature for everything. It's kind of like that. We have that Venn diagram effect with histamine. I think that's important. It's an easy kind of illustration that allows people to wrap their heads around what's going on. Now, what else can we do to see if histamine's an issue? Well, let's look at some natural degranulating histamine supplements. So B vitamins, B6 is a really important B vitamin for brain health. It also can help with histamine. Things like stinging nettle, right? Let's sip on some stinging nettle tea. How do you feel? Let's maybe add in some bromelain, right? Or some extra potassium. Let's maybe add in some N-acetylcysteine. And I have a product called AllerClear that has a lot of those things in it, which works great. We'll put a link below. Higher dose vitamin C can be helpful. We may even do just a really good kidney glandular. Kidney tissue has the enzyme DAO in it, and that enzyme breaks down histamine. So let's maybe throw in a couple of natural histamine degranulars, maybe one supplement. Maybe we'll get some kidney tissue, throw it in. Does that help? Does that make you feel better? Let's get some stinging nettle tea. How do you feel? If that starts to make you feel a little better, then histamine could be part of the puzzle. We just have to make sure we segregate in our brain palliative relief and root cause solution, right? And a lot of times, some doctors are root cause solution. The problem is there's no palliative relief, so the patient kind of suffers. So we kind of want to do a hybrid of the two so we feel better faster. That keeps our faith in the practitioner and in the process high. We feel better, we perform better while we get to the root cause. And we kind of have to have that approach, or we're just on this journey of suffering, hoping one day we'll heal.
Yep, very, very well said. And how you're implementing these is typically before the meal. So like you're mentioning the stinging nettle tea or the kidney glandular, it's going to be best, what would you say, maybe half an hour before you're going to eat these, potentially, let's say avocado. You're going to sit down, have a meal of avocado. You may want to do your stinging nettle tea, your DAO, You
could try it before. I mean, the food, it's going to interact with all the histamine's going to happen when the food goes in your body. So as long as it's in the same time, I think that's going to be fine. But I would experiment doing it ahead of time so you have that kind of already going. Try both.
Yeah.
Yeah, I think that's good.
And then regarding there's always this question, I want to get your thoughts, the argument of potential downregulation, like if you're doing the DAO supplement. Do you have any issue or any concern with people doing these DAO supplements around the meals? Every time they got to pop this, pop it, pop these capsules, and then all of a sudden they want to try to get off of it. Have you seen any issue or any need to like wean off of those?
I mean, it just depends, right? As long as you're getting to the root cause, there's more than likely not going to be a problem. So with enzymes or any digestive support, I just don't see that being a problem with disrupting the feedback loop. It's a positive feedback loop. It's not a negative feedback loop, right? Negative feedback loop is you shoot up some testosterone, your testicles shrink. That's a negative feedback loop, right? More testosterone comes into your system, inhibin goes back to the brain. More inhibin means less LH means less testosterone, therefore the gland shrinks. That's like a negative feedback loop. A positive feedback loop is, hey, more enzymes, more acid. Oh, that actually stimulates more gastrin or more stimulation for more production of that. So it's a positive feedback loop. Typically, you're not going to have atrophy per se, but more importantly, think of it as like a crutch. It's just taking pressure off your system so that you can heal. So you wouldn't be like, well, I'm going to get dependent upon this crutch. I'm going to just walk around on my broken ankle. Well, no, because you won't heal. So of course, at some point we can try cutting off as we feel better, as we know we're infection free. We can start coming off some of the digestive support, maybe find our healthier meals, our cleaner meals when we're eating and it's very stress free. Let's just try maybe one meal a day without that. And then we can just kind of go from there and see how we do and gently come off. I think that's a good way to approach it.
Yeah, good advice. And we've done podcasts before on restoring acid and enzymes, and we've talked a lot about Dr. Jonathan Wright's book on HCl and how you make less HCl as you age, and as you add more to the fire, you're not subtracting from the original fire, you're just building more logs onto your little fire. So I just wanted to cover that again because I know people have that in their head. If they're on these supplements now, they're always saying, well, how do I get off? How do I get off? And I think the answer is you will, assuming that you're fixing everything that led to this dysfunction in the first place. Unless you're like 80 years old, in that case, maybe you do need some supplemental, DAO or enzymes, because you're just making hardly anything at that age. And you really want to get back to eating your orange or whatever. Maybe you can't do it if you're age 80. I mean, we do have some clients that are up there in age, and we often just give them a small dose of acid and enzymes just for good health insurance.
And there's a lot of histamine drugs that are out there. I may mess them up, but you can go to rxlist.com to confirm. But you have like your Zyrtec, Pepcid AC is one that works on histamine as well. You're going to have some of your allergy ones, or a lot of times are going to be histamine based. I think Singulair may be a corticosteroid one. Usually your allergies come in two categories, right? It's either going to be histamine, like Allegra, I'm pretty sure, and then you have your corticosteroid ones. I think Singulair is a corticosteroid one, so it's going to be either a histamine or corticosteroid. And so people that are really histamine sensitive and they do better cutting the histamine down, or they feel better with a histamine drug and it helps those allergy symptoms, that's good. But now let's try working on the diet. Also, clean air. If you have mold or environmental stuff that's stimulating histamine, get your air clean. We'll use the Air Doctor or the Austin Air or some of the advanced air filters. We'll put links down below. Evan has some links as well. So if you guys want to get a good air filter, air can be a big stimulator of histamine. If it's cedar, like in Austin, cedar's a big deal, right? Especially this time of year. That could be really helpful internally inside the house. And then we may throw in some of these natural histamine things as well. The side effects of the histamine drugs is they can make you groggy and tired. They may work a little bit with the symptoms of histamine, but they can make you tired and fatigued on the backside. So you kind of just have to balance that out. If there's a natural solution, obviously, and or a root cause solution, that's always better to do first.
Yeah, Benadryl's one, too.
Benadryl, another one. Yep.
And those are now the drugs are negative feedback loops. We were kind of talking about this idea of negative and positive feedback loops. The drugs they do have some sort of crutch effect where when you try to get off, you do have an issue. I'm not sure of the mechanism right away, but I've looked at a few papers on like Benadryl, for example, and some of these prescription antihistamines and what they do. I believe they actually deplete DAO is what they're doing. I think that's the mechanism.
Yep, it can, absolutely. So your big ones are going to be Allegra, like I said before, Claritin, like I said. You're going to have Zyrtec. So good, I was on track. I know my medications enough because every time patients come in, I have to go look them up and look at the mechanism. When you understand the mechanism of how a drug works, drugs typically work by blocking or inhibiting various enzymatic pathways. So drugs don't ever uplift or enhance physiology. Functional medicine does. The things that we do uplift and enhance physiology while we work on taking stressors off the system. So drugs don't do that. They block and inhibit enzymatic pathways. So it's nice to know because if this drug works over here, what pathway? It's a beta blocker. Okay. Well, you have blood pressure and anxiety issues. Well, beta blockers work by blocking the receptor on the heart that stimulates the heartbeat, but so does magnesium too. So maybe let's add some magnesium in and get your cortisol under control. Magically, your blood pressure comes under control, right? So there's a lot of things we can look at and we can trace back the drug, trace back the mechanism of action while we get to the root cause and use natural things to help with the symptoms palliatively at the same time.
Yeah, well said. Yeah, when people come in with a list of drugs, it's a very good... I would say it's almost a good tour guide of the body, wouldn't you? It can kind of lead you into, obviously we're going to do a good clinical assessment and workup to figure out what labs to use, but we can use like the anxiety example. Okay, she's having anxiety and heart palpitations. Okay, where's that leading us to? Or depression. Okay, why is she having depression? Let's go look at the gut. So I think it's a good tour guide to see the list of drugs, to correlate to the symptoms, to then correlate to the body system and how those dysfunction.
Exactly. And what are the big side effects of antihistamine? It's important to know: dry mouth, drowsiness, dizziness, nausea, vomiting, kind of being restless or moody. Difficulty urinating, blurred vision, and confusion. So if you are on histamines or need to be on histamines and you have those side effects, well, you really want to start looking at getting to the root cause because the medications may be causing more problems than not. But, make sure you see your conventional doctor on that. Let them know kind of what you're doing so you don't just jump off things fast. We want to be responsible in how we adjust our dosage if we do.
Yep. Well said.
Anything else you want to add, Evan?
Well, of course, you've got the risk of like severe, anaphylactic reactions. Obviously, that's going to be an extremely small percentage of the population. But if you're somebody who has been on these drugs, you're working with a practitioner, you're trying to go from conventional drugs to natural remedies and such, you still may need to have, if you've had a history of issues like this before, the tongue swelling, throat closing, you may need to have your EpiPen on hand or possibly a junior EpiPen on hand if you've got kids that have these type of issues you're trying to resolve, because you don't want to try to be a tough guy. I'm getting off the drugs, I'm going natural, and then something bad happens. So obviously we're talking like 0.1% of the population, but it just needs to be said.
100%. And just anyone listening here, just try to, in your mind, have two tracks, right? What's root cause? What's palliative, right? If you have those, you're set. And then also, what can I do to create a better environment? If histamine may be an environmental issue, like I gave you with the analogy in Austin and with the cedar, keep that in the back of your head, right? Or an Evan's situation with mold in your home, keep that in the back of your head. So we kind of have to have an algorithm where we look at, the environmental things outside of our body too, to make sure those aren't a stressor.
Yeah, it gets left to the wayside often. People don't often bring the exterior of your home, your air quality. Like, these are the missing pieces of the puzzle. Maybe an allergist would pick up on that, but allergists are so myopic with their focus that they often miss all these other pieces that we're looking at, gut, liver, and
exactly. But then there are also practitioners that are out there, and it gets scary with patients that don't know what to look for, where someone comes out and they're just like, they're a certain mold practitioner, I won't say who, they're a certain kind of mold practitioner, and then they're all about mold, and they're only focused on mold, and then they don't know how to remediate their mold right in their home, and then they want to spend $100,000 on getting the mold remediated, and then they're doing all these protocols to get the mold under control, where there may be some food stuff, there may be some gut stuff, so you can't just be myopically focused on one thing. So if someone's only focused on one track and you're working with them, that should be a warning sign, unless they've thoroughly ruled out other tracks and are already supporting those tracks. If someone gets myopically focused on one thing and ignores lots of other things and can't give you a good rationale why, that's a warning sign to everyone listening.
Yeah, and it's very sexy, right? From a book perspective, a podcast, a website perspective, a branding perspective, to label yourself as the blank guy or the blank girl in terms of your, quote, specialty. But those specialties have led to many, many hundreds of thousands of dollars in failed protocols. And then we have to be the cleanup crew, because we kind of market ourselves as functional medicine, but that is general, but yet we dive into the specifics. And you have to be able to zoom in, zoom out. You can't just zoom in, because you'll miss some really low-hanging stuff that gets people better.
I've seen a couple of practitioners out there, I won't name who the person is, but this person markets themselves as a gut person. All they do is gut. And I've seen a lot of their patients, and guess what? That person had a thyroid issue or an anemia issue or a hormone issue, and they were just totally ignored. So it's okay to market to a specialty, as long as when you're addressing that issue, you're still looking at other systems. So just be careful with someone marketing one thing, but then when they go to treat that, they're only treating that one thing. Make sure if they're marketing something and they're treating that, make sure they're also assessing everything around it, because that can be a warning sign. So keep that in the back of your head. And then also, one thing, because it's very daunting when you find out you have mold in your home. It's like an absolute punch in the gut. So if you think you have mold, or you're not sure about how to address mold, take a look at my podcast with JW and Jeff Bookout. We'll put links down below. They've done I've done 2 podcasts with them that they really talk about how to remediate, test, assess, and treat mold in your home in a very, very cost-effective way. That's not going to, be as stressful as the conventional ways years ago that were just really daunting at $100,000 or $50,000 to get your home fixed.
Yeah, we'll save it for another day, but just quickly, before I became friends with Jeff and JW and got to interview them, I had spent $10,000 out of my pocket on an enzyme-based solution. And guess what? It didn't work nearly as well as the solution that costs like $1,000. So I spent 10 times more and got less benefit. So yeah.
But probably better than the conventional corncrobium or some of the more toxic stuff. Probably better than that, though, at least.
Yeah, it was. It was. From a toxicity perspective, it felt fresh. It felt clean. It was kind of a clove and enzyme type blend. But still, I mean, it was $10,000, and then the Petri dishes still showed as an issue, and more colonies were growing than what was safe. So, yeah, I mean, we could go on and rant about that, but let's wrap it up. So if you do want to reach out clinically, we would love to help you. We love the opportunity. We love serving. I mean, this is just our passion and our calling. You can reach out to Dr. J, Dr. Justin. That is at justinhealth.com. My website is evanbrand.com, and we have the ability to schedule intro calls as well. So 15, 20 minutes, you can chat about your symptoms and goals and see if you're a good fit for care. Let us listen to some of the things you've already tried. What have you done that's worked? What have you done that hasn't worked? What practitioners have led you down good paths, bad paths? We want to hear about it. So don't hesitate to reach out, and we'll be back soon.
Thank you, Evan. Appreciate it. Anyone listening to this content and enjoying it, give us a share. Sharing is caring. Thumbs up. Make sure you subscribe as well for that YouTube algorithm, and appreciate you guys joining in. Everyone have a phenomenal day. We'll be in touch.
Take care.
Take care. Bye now.
Bye-bye.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.